Hi, good morning. Dr. Patel here with Hillside Medical Group, and I am doing this training video for your Practice Fusion EMR. By now, hopefully, you already had access to Practice Fusion and you're able to log in. The staff, our director of operation or manager may have helped you already set up your account for Practice Fusion, along with getting you at least initially started on getting your e-prescription verification done along with just being able to getting your credentials verified. Wonderful. So I'm doing this next part where I'm going to just walk you through what the EMR looks like, how to do the charting, etc. So said that, this is your home screen, and once all the setup is done, you're probably never going to be on it, but every time you log in, it will be over here. In case if there are documents that are getting scanned into the system, they should be attached to the patient chart already. But if not, it would be in this document section to it. Directory is for all the consultants would be listed over here. And as far as the settings, you should really never have to go to the settings on this part. You would only utilize this log out button. Wonderful. It'll have your name on it along with our Hillside medical group documented over here. And on this end is what you'll be utilizing, especially these 1, 2, 3, and 4 buttons. One of them being scheduled, tasks, charts, and then messages. So we'll go through one at a time. Of course, some of it I may not be able to do it directly because to respect our HIPAA, but we'll see how much we can get. All right, so schedule. When we're looking at the schedule, again, when you do the schedule, this is a demo playground area, but when you look at the schedule, you'll see it in a few manners. One is by your appointment for the day. You can look at it in a day view, you can look at it in a week view, or either or. Perfect. So when you're looking at it again, second set of narrow downs that you may get over here, which is users, you can drop down and just select you or a colleague that's working with you at that site. So that way you can help each other depending on if one other person's running behind. Always display options will be grayed out. Nothing to do that. And then over here, always make sure that appointment type is all. In case if the front receptionist, virtual assistant, someone were to make a mistake on a specific appointment type, then you may miss that patient. So make sure it's always selected to all. And then appointment status, I usually don't really necessarily care about all the canceled or no-shows, so I gray them out. As your list gets bigger, I usually don't even like to have pending arrival in there, but that's your call on how you want to see it. I like my schedule to be clean on people that are already in lobby or in room, but again, that's up to you. And I also get rid of scene because once I'm done with them in the exam room marked scene, then at that point, I just need to move on and it just clears out my schedule and makes it look a little more clean. But everyone has a different preference to that. Wonderful. So looking through that, when you're looking at the schedule, it'll have these different information on it. So let's take a look at what we're seeing. So this patient, again, it shows pending arrival. So the patient has not shown up to their appointment yet. The name of the patient, date of birth of the patient, and the phone number of the patient. What else their appointment time and who's the provider that they're going to see or assign to today. What is the type of the appointment? Is it a new patient? Is it a follow-up? So it'll give you that. And the chief complaint. Now, chief complaint over here is only as much as the patient provides to our staff, which is extremely limited. Sometimes they don't want to share information of what's going on with them. So it may just be a follow-up or established care or a new patient, and then they'll give you a laundry list of their conditions over there. Confirmation is, our virtual assistants call the patient to get a confirmation. Patient, once they're added to the EMR for the appointment, they actually end up getting an email confirmation to confirm their appointment. If they're more than a week out, then they get an email notification again of their appointment a week prior to it. They get a text message 48 hours prior. They get an automated phone call 48 hours prior where they can confirm their appointment. And if they don't do any of these, then virtual assistants also make a phone call again at 48 hours to confirm their appointment, to get accurate information of their demographics and insurance information ahead of time. Perfect. The copay is a hit or miss, so not accurate, and eligibility is hit or miss, so not accurate. So these fields don't make much of benefit at all. Wonderful. So now set that. That's your schedule. When the patient arrives, then front receptionist will drop it down to arrived. So it'll show in lobby, and as soon as it's in lobby, it'll create an encounter which we can work on later. You never want to go to the patient chart and create a new encounter prior to them coming in. Otherwise, you'll create two encounters, and then you're going to need to go back and delete out the encounter. So never create an encounter until they show up in the office, and it automatically creates an encounter. Wonderful. Going down, then what the next step that should happen is once the front receptionist checks them in, they will change the status to MA ready, which means that, hey, medical assistant, you're ready to take these patients to the bath. I've done my part in the front reception. Once the MA does all of their information, or when they're taking you to the back, they should change it to theoretically say John is my MA, so it would say John 8, which means he's taking this patient. John is a MA taking this patient to room 8. Once he's done with this patient, then he'll do change room and say ready 8. Done, which means the patient is ready for the provider to go see this patient now. All right, wonderful. So we're gonna leave this much for at this time before we go into the charting. And then there's a task button. Again, task buttons is where you will find med refill request, and you will find charts that you need to that are pending for you to finish and sign, along with lab that needs to be signed by you. So that's where you'll find it. I'm not going to hit on it because if I do, then it's going to go into and share a lot of HIPAA privacy data, which we do not want to share at this time. All right. And now, say, John Dorian came to your office about 4 days ago, and you're just wondering what happened with their labs. I need to go pull it up because in your little pad you wrote it that, hey, I need to follow up on this. So then how do you go back and find that patient? One, if you know the date you saw him, you can just go to the calendar and go to that date. Or you can go to chart, and then you can type in their name. John Dorian, you can put in their date of birth, you can put in their phone number, some sort of a demographic as it suggests over here, that give me their first name, last name, give me their phone number, give me their date of birth, etc. And then it'll list that patient. You can click on the patient chart and it'll take you to their chart where you can go and review whatever is necessary. Another thing is messages, all of these messages, like it shows in mine, it should be really down to the most minimal numbers. This message that you see one may have just shown up within a matter of a few minutes. Otherwise, it should be completely cleared out, because if you're not clearing your message, then the people that are sending you message is not getting an answer. Then they need answer. So make sure you're clearing your messages out every day, and then reply back. Always close the circle, right? So someone send you a message, hey, can you please send in a refill on this medication? And you don't want to do it because the patient has not followed up with you in appropriate time. That's okay. Reply back saying, hey, refill denied because patient needs a follow up. That way, then that person can call the patient and inform them, listen, doctor's not going to send in the medication. Well, you need to make a follow up appointment. Otherwise, we won't be able to do this. So always close the loop. Always reply back to your messages and keep it down to 0 because they should be down to 0. Reports, you really never should have to go back to these two, so not worth going over. So we're going to go back to the charting and see what else is there to look at. So, okay, this is a patient shown up, room 7. I worked on this patient and I'm done with it, and I'm going to just drop down and then say change room 7, check out. And that way your medical assistant knows I need to go back to room 7 and check out this patient. Or say you need to get a steroid injection, then just do 7 IM steroid. Or you want to do flu, rapid flu test, 7 flu strep test. Whatever it is, you need to just change it over here so your MA knows that they can go do it. Verbally go also let them know. But in case if you can't, then make sure you're always changing it over here. And then you're done with this patient and you just want to do scene, then just do scene and get that patient off the panel, and they're done with it. So I usually get this out. So scene, the patient's gone, and I'm done with this patient. Now, let's look and see what does the chart look like. Say you're sitting in your office before going into the exam room and you want to just do a quick summary evaluation on what is this patient. I forgot who John, demo primary care is. I need to look through their chart before I go into the exam room. Okay. Click on their name and it'll bring you to the summary section. Now, summary section, we've stopped putting in diagnosis in here. We've stopped putting in past medical in here. Medications should be there and allergies should be there. But besides that, limited data over here. So, but you can look through their medications and then you can look at their previous history on what they have, what their note looked like, what they were here for. So I would just down to this button, which is history. I use this a lot to review their labs or to see what sort of orders were placed and what their previous visit looked like. So I'll just drop down over here. I see that the patient had come in on September 28th, labs were ordered, and then the patient's coming in today. So I would just drop down and review it quickly. But okay, the patient was here for hypertension, hyperlipidemia, diabetes, anxiety, depression, vitamin D deficiency. These are their chief complaint. Here's what was going on with them. So I can quickly review what their past medical, social, etc. look like. So I'm ready to go. When I'm with the patient, I can see what the plans look like, review it, and see that, okay, yeah, I asked the patient to follow up with us in get labs done in 3 months, a follow up in 1 week for this foot infection that the patient was dealing with at the time. Never came back. So when I go in, I can say, oh, John, what happened? You were supposed to come back to us to follow up in a week. So how did your foot infection go? Tell me what's going on. So I know where to initiate the conversation. So that's a little history button. It's a great place to review lab results. This is a demo patient, so of course it doesn't have lab results, but otherwise you click on the lab results, it'll show up all the lab results over here. You can review it before you go into the patient's room. All right, so summary is what this would look like. You can manipulate this if you more like your diagnosis on this side, then you can bring it over. If you like your past medical over here, depending on how you like to look at it, you can change it around by doing display settings. And then you can move these fields around the way you want it in your chart. Save and it'll change that out. Perfect. Timeline is where you would go to see what the previous encounters look like, what were the documents that are saved in the patient's chart. They say that, hey, did you get a record from my GI doctor? I would go to document pending, see if there's anything there. No. I would go to document signed and see what sort of information. No, I did not get that imaging result. I did not get that consult note. Or if you have it, then, oh yeah, I got it over here. I'm looking at it. Wonderful. E-prescriptions will show you whatever the prescriptions sent for the patient in the past. Lab orders will show you what were the labs ordered by which provider in the past. Lab results, like I said, will show you what the results were reported for the patient. And imaging orders, the same thing if you had ordered any imaging for this patient. Wonderful. Document, same thing is as documents pending and signed. Quickly, you can go there, documents pending or signed, and it'll show you the same documents that are in patient's chart. Profile is really not for the providers more so, but for the staff where they can change around their address, phone number. But you can potentially also do that in case it's in the back. They say, oh, my number is not really this, actually changed. So you just go to profile and change out their number. Or if you want to add their pharmacy, you can add a pharmacy over here. When you're adding pharmacy, you need a zip code is the best way to do it. So I'll say 78233. And then they say, oh, my pharmacy is Healthway Pharmacy right here. I'll just select and close. And the pharmacy is added to the chart. Save. We're done with that. Now it won't do it because there's no demographic address. And save. Done. So the accurate address was not there, but it's saved now. You really don't need to ever get into the payment collection in Ledger, but those are also there. So going back to summary, let's say you want to get to, now you reviewed this John's chart, and rather than going from summary to your SOAP note, which you can go from view encounter, or you were in your summary and you want to directly go into the note, you can click on the encounter over here and it'll take you to the patient SOAP note. So what are we seeing over here? Again, a lot of repetition more than anything else. If you click here, it'll bring down that summary section to it, which shows again diagnosis, messages, allergies, medications, past medical history, family history, and the encounters, just like a summary screen. Or we'll start looking through the SOAP note. So let's say this is a patient office visit, primary care. Today is the day, theoretically, let's say it's the 27th today, and the patient is being seen by me. What facility, depending on, it will automatically change it over to your primary facility over here. We really don't do much with the chief complaint over here because we end up putting it in our note. And then as we go down, this is a hit or miss. So I would not rely on the labs over here. I would always drop down over here and look at the lab results. So please remember, hit or miss, sometimes it'll get reported over here, so you'll miss it. So make sure you're always looking at your lab results over here. And as I go down, 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 I can review some labs or through the drop down, but the vitals should always be there. So the vitals will be there based on what your medical assistant had done, the data entry already. Super, super important. If the patient says that, hey, listen, at home, my blood pressure runs normal, it's your theoretically, let's say your MA put in that the labs blood pressure was 150 over 100. But the patient says, listen, you know what? I think I was just anxious today when I was here, and at home, my blood pressure runs at 130 over 68. Correct it out. And if you're not planning, if you believe that and you're not planning on changing medications, etc., change it out. Because if you don't, then the insurance company will look at that, will not review your note. They will look at this part and penalize the patient and the practice, saying that we did not do a good job at controlling patient's blood pressure. Correct it out. The medications, it will give you a list of medications that your MA had and data entered in or part of the chart from previously. So super important to that. And if you wanted to send in new medications, you just do add and you just start adding new medications. Now say, we'll come back to that. So you just type in, you want to start a new medication called amlodipine. You just type in the name of the medication, 5 milligram. You drop down 1 tablet daily, order, and then just put in how much. If it's a new patient, we rarely ever send out more than 30 tablets. You want to make sure they get labs done and come back to you, and almost never we send in more than 3 months supply. So I'm just with 30 tablets. It's me sending it. And say, in case if this patient were to say, I need refill on all my other medications too, then you just stop right here for a second, and then you click through all the medications that they need refill on. Perfect. I'm going to do 100. I'll do 30 to this. I'll do 30 to this, or twice a day, so 60. I'll do 30 to that. Why did I do it? Because it's an over-the-counter allergy medication, so I just sent in 100, but otherwise I would do that. Next, just keep going next, and then now your pharmacy is selected already. But say the patient says, no, I don't want to go to Healthway, I want to go to CVS, okay, 78233, the zip code is still that, and I'll just do that along with the name, which there is no CVS in this zip code. So let's find something else. For the sake of this purpose, let's say he wants to go to Sam's Club, so I'll just select that. And the pharmacy Sam's Club is selected, send the prescription, and it will go through. The order is not going through right now because, of course, this is a demo patient. For that reason, it's not doing it. So, but I think you guys get the point. Now, said that, say this is a base patient and they want to printed prescription. We don't keep prescription pads in the office for many reasons. One, you want to make sure that no one is stealing your pads and writing prescriptions for themselves. Another is electronic prescription is the way of doing it, so there's the accuracy of it. But what you do is rather than doing send ERX, you just drop down over here and you do print. And then here are your prescriptions, print, and drop to your printer. And once you do that, it should send it. Now, when I do this, I actually try to make it a little smaller, which is not that. I drop it down to custom, and right there, it would look like that, and then print. So that way, now all you need to do is go to the printer and just sign the prescription, and that should do it. I'm gonna cancel this, but this is how you print your prescription. Wonderful. All right. So that's medication. As we go down, here is your slope note, subjective, objective assessment plan. Now, at this time, we are doing SOAP, but with the Sully AI technology, this will just end up looking like one spot, and I'll show you what that should look like. It's not allowing me to do it because there are medications attached to this chart now. But it should, let's see if it allows me to do that now. Yep. So now it will look like this. And what you do is from your AI technology, which you will do training, if you've not done it already, you just copy and paste that part in here. And your note will be pasted in. Again, same one EMR allows you to do multiple things in just different places. So again, same thing, you can add medications from here or above, or from the summary screen, or from this summary screen. You can add lab orders from here, add a lab order, and then there are templates made for lab order as long as you use it. If the patient wants to send the medication or labs to CPL, you can choose that. If they want to send it to Hillside Primary Care Lab, you can do that. They want to send it to LabCorp or Quest. The templates are made for all labs for diabetes, arthritis panel, for 3 month follow-up for hypertension, hyperlipidemia, for TB test, you have to send it to Quest because I believe they're the only ones that has a quantiferon gold. So when you click on the TB, then it'll or immunization panel, it'll show you that okay, most of the places will ask for a hepatitis B immunity, varicella, MMR, and TB. So you just click on the template. After you decide which lab it needs to go to, you just go through next, send, and the lab order will be sent. Now hold on, it'll give you that received, and now the lab is gone. You can close out. So going back to the labs, you can order it directly from here, or you can go to actions. Actions is where what you want to do for the future. Okay, so I want to send in a referral. I want to send in a imaging order. I want to do lab. Again, same thing done 5 times different ways. You can do it directly through actions, or you can come down over here and do your imaging order. You can do your lab order. And I believe on the bottom, there should also be referral right here. You can also do the referral. I think that sums up our charting aspect of it. Again, going back to it, top, it'll show you what kind of visit this is, who's seeing the patient. As you go down, labs will start flowing through. Hit or miss, so you always want to drop down over here. Then your vitals, followed by your medications, and then you can go down over here. This also can be display settings, can be changed around on how much details you want. So you click on the display settings. You can say that, hey, listen, I really never look at the health concerns part because no one fills it out. You can just get rid of it. Hey, the flow sheet, I'm always going to be looking at this drop down, so I really don't care for it. It's just cluttering it. But then, problem is it won't show your vitals, so you should always keep the flow sheet. Medications, note, and then I would probably keep all of these things, save, and here's done. It will get rid of that extra part that used to show over here. It's gone. Wonderful. So to recap, note going down then, as we look at the vitals, the medications can be sent. Here's your note. Here's your lab order. Here's your imaging order. Here's your referral, and you're done with it. If you want to directly send a message by tagging this patient's chart because, hey, Dr. Patel, can you please review this chart? Review. Can you please review this chart in lab for me? Thank you. All right, so you add to the chart, so it will stay in the patient's chart, and along with what you're asking me to do, and send. Now, when I refresh, it'll say 2 messages. It'll show up over here. Always encourage you to do everything in the chart. That way there is a record of it rather than doing verbally with your medical assistants or front reception. So that way no one can come back and say, "Oh, you never told me that." No, look, the chart has a record of it. Super important. One interesting thing a lot of people don't know about is, again, send a message from here. But one interesting thing, if the staff had gotten their consent to get the prescription records from when they booked appointment, and it's been more than 24 hours, because it takes 24 hours to populate, you can actually drop down over here to view prescription history, and it will show you. See, it says the record not consent not done, but if they had done it, then it would show you all the medications that the patient had filled at different pharmacies, so you can. It'll make a medical assistant's life easy, or and yours, in case if the patient can't remember. Oh, I can't remember what was the blood pressure medication. You come over here. You'll see it. Oh yeah, it was lisinopril. It shows it in your chart. Now again, that's also a hit or miss, but it's a neat thing when it does work. Perfect. Last thing, you save it. If you're already signing your charts, you sign it. Most of the folks have graduate or review first before they start signing their notes, but otherwise you would sign the chart and you'll be done with it. Now, say you're one of the televisit providers and you're doing televisit on this patient, then you would just come to the chart, review it, and you start doing start video visit. And the first time you're coming on, it will register you to this platform. It'll get you to consent. Hey, are you ready for, or would you consent? And it'll create an account. And once it does, you just do that. And then you just click on the patient's name over here as it shows up. And then you just do send invite. Now, this is a demo patient, so it's not doing it. But otherwise, send invite and it'll go there. And then once the patient comes through, let's try doing it. Let's say you're doing televisit with me, you're sending me a text message, send invite. So my phone will get a text message, which it did. And I'm going to click on it. I'm going to say, join my televisit. It's asking me, do you need an interpreter? No, I do not. Allow access to your microphone. So on my phone as a patient, I said allow. I said, and you noticed that it turned green over here. It says allow access to camera. I said allow. So you saw it turn green over here. Now as a patient, join call. So now I am waiting for you over here. It also has a message, hey, Dr. Patel will be with you as soon as possible. Please wait and do not leave. Thank you. And then I'll say start video visit as a provider. And when you do that, here is the patient on this side and you on this side. And patient hung up now because you're done with it. And then you will do the same end and then discard summary. And then you're back to your waiting room. So this is the video visit portal. Now you can, what I normally do is I just take this video visit part out and just put it on the side as I am talking to the patient, and I can continue to do my charting on the side because, I would probably narrow this out a little bit over here. So that way I can continue to do my charting as their video is going on the side. Wonderful. So this is the SOAP part of it. I hope this helps. And I don't see anything else that needs to be added on to this. We'll go back to the schedule. Once I'm done with it, note signed, I will go over here, mark it seen, and we're done with this patient. And the patient will go away. And then go on to the next patient. I hope this helps. It's a quick start to it. And if you have any other questions, please feel free to let us know.